So remember, whenever RAAS pathway is activated, the blood pressure of the individual increases. Now we will use the first group of drugs which will antagonize the RAAS pathway, which are nothing but the renin inhibitors. Right, which are nothing but renin inhibitors. Now, these renin inhibitors, they will directly inhibit the enzyme renin. Now, what is this enzyme renin useful for? This enzyme renin, it is useful for the conversion of angiotensinogen to angiotensin 1. So, if you directly inhibit this particular enzyme renin, then there is no conversion of angiotensinogen to angiotensin 1. So, what are those drugs are? Those drugs include aliskiren, right? Next, the other drug we have ramipril, right? The other drug we have enalapril, right? Enalapril. All right. Now, so these are the drugs which are having the direct renin inhibitory activity. Now, so these particular drugs, what they will do? They will decrease the activity of RAAS. Right? They will decrease the activity of RAAS. And let me tell you the route of administration of these particular drugs. All these particular drugs, they are used orally. Right? All these particular drugs, they are used orally for the treatment of chronic hypertension. Right? For the treatment of chronic hypertension, this particular direct renin inhibitors are being used orally.